This video will show you how to complete the pre-operative checklist for adult patients going to theatre on eCARE. Patients who require emergency or elective operations in either Phase 1 or Phase 2 theatres may be located in several different areas. If your patient is over the age of 16 and is having an operation, the adult pre-operative checklist must be completed on eCARE. From the patient's record in PowerChart, I will ensure that any vital signs have been recorded prior to completing the checklist and that any point-of-care tests such as a capillary blood glucose or a urine pregnancy test if required have been undertaken and documented in the correct place on iView. Now I am ready to complete the checklist. I will navigate to Ad Hoc and click on this button. I will then select Surgery and then select the pre-operative checklist. I can either double click to open the form, or I can select the radio button to the left of the text and then click on the record button. In the pop-up window that opens, I will confirm details in the first 4 tabs within the form. The first of these is to confirm the patient's height, weight and any allergies. I can see here this patient has an allergy to penicillin, so I will make sure that she has a red wristband on one of her wrists. I will also confirm how tall she is and that she has a recent weight that is measured, and I can amend these if necessary. Next, I can check for any relevant procedure histories. I can see that she has had a previous appendectomy back in 2018. I can then check her medication history to see if she is taking any medications that she's brought in from home or if she has been prescribed any medications during her stay in hospital. And finally, I can check her past medical history. I can see that she has asthma and type 2 diabetes. Once I have checked and added any extra elements to the first 4 tabs, I can then select the relevant checklist. I will be selecting the adult pre-operative checklist. This will open a further pop-up window. This section has some mandatory fields that I am required to fill in before I am able to sign the form. Firstly, I can confirm the date and the time that this patient last had some observations recorded on eCARE. And then I can move on to this section around if the patient has diabetes. If a capillary blood glucose has been recorded on the point of care section within eCARE, these results will be displayed here. If the capillary blood glucose was completed more than 60 minutes ago, or one is now required, I can document that on this form. If I select the No option, a further mandatory field becomes available, and once I have completed the test on the patient, I can record the result, and when the form is signed, this will be recorded to the point of care tests within iView. I can then indicate when the patient last had something to eat and drink, and then I can document this patient's last menstrual period. This is a free text box, so I can either write a date or I can just free text a duration of time if the patient is not sure. Similar to the capillary blood glucose, if a urine pregnancy test has been recorded within eCARE, the results will be displayed here. If a pregnancy test has not been recorded on the morning of surgery, you can, like the capillary blood glucose, record this within this form by selecting the No option, and then the same options that are available when you record in point of care tests on iView become available to choose. I can update this if required. This patient already has one, so I will select Yes. Scrolling down the form, we have a section on COVID-19. This section will now display the most recent results within the last 100 days of a COVID-19 PCR test and a lateral flow test if those results are recorded within eCARE. If this patient is having elective surgery, I need to confirm that they have been isolating for 72 hours prior to their admission following their COVID-19 swab. I have already confirmed the VTE assessment to ascertain if my patient needs anti-embolic stockings or not. I will measure and record that result here and then document what size stockings I have given her. I will then complete the preparation of the patient checklist. Now I have completed the preparation of the patient checklist, I can complete the ward staff preparing the patient details. I will enter my name and search. This will enter my details in here. Then I can enter today's date and the time. This section may pre-populate with your details if you are the person opening the form. Next, I can move on to the surgical and anaesthetic confirmation checklist. If I am a registered nurse or practitioner and the patient has seen the surgeon and the anaesthetist and is ready to go to theatre, I can complete these as required. If not, I can select them all as pending for a registered nurse or practitioner to complete later. And now I am ready to sign the form as all the mandatory fields have been completed. If I click on this blue button up here, that will return me to the main body of the form, and then I can sign the form by clicking on the green tick. Now my patient has been seen by the surgeon and the anaesthetist, a registered practitioner can amend the form and update those pending sections. So I, as a registered practitioner or nurse, can navigate to the form browser, find the checklist or form that I want to modify, right-click, and then select the Modify button. The Modify button can also be used if you need to update the form for any other reason. I will then navigate to Adult Pre-op Checklist, and then scroll down to those pending sections, and then amend them as required. And then I will complete my name and today's date and the time. Once I have completed that, I can then re-sign the form. The form is available for viewing and for modification via the form browser. It is also available to view only via the clinical notes or documentation section. I will click on clinical notes and then navigate to the checklist or form or documentation that I would like to view and select it. This will then produce the form in a text-only document, and I can scroll down to see the results of the information that I have added, including any that have been amended. The previous results will be scored through and the new results displayed.